Okay, so this is the time of year when we all go off skiing, and one of the risks with skiing is knee injuries. And it's a big thing that we see in physiotherapy, especially after that Christmas period. So we don't want injuries. So what we're going to do today is talk about how to go about mitigating some of these risk factors that you get when you are skiing. One of them risk factors is when we're skiing is this kind of internal rotation and that knee dropping in. That's a huge risk factor for ACL injuries. Obviously, when we're in skis as well, we're putting ourselves in more of an awkward position. So we're going to talk about 3 of the best exercises that you can start doing today before you go skiing to build strength and conditioning and balance and control through that whole chain. So this first exercise is going to focus on stability and control through that entire chain, but more specifically while you're going through this deceleration phase or that eccentric phase or that loading phase. Okay, so the exercise that we're going to do for this is called the single leg squat or the single leg sit down. Essentially what we're going to do, find something that's quite low. This might be too low for you to start with, so in that case you go a little bit higher. And what we're looking at doing is taking 1 foot off the floor, and then nice and slowly we're going to sit ourselves down. Why is this important? Well, basically, as you're sitting down, what you're doing is you're loading through that knee, and there's a lot of force going through that knee at that very specific point. And if you come round to the front, you can see a few things might happen if you don't have that good stability. Number one is your knees going to start shaking all over the place, okay? So having that control going through gives you way more stability when you're on the skis and things like that. The second thing is, as you come down, if you find that your knee starts to come inwards like this, that's putting you at a risk factor of a knee injury, especially when you're going through that kind of loading phase. When we're skiing, if the pressure goes down and the knee comes in, that's when we start to get them kind of ACL ruptures and things like that, okay? So this first exercise, the single leg squat, what we're looking for is slow and controlled movement on the way down, trying to keep that knee going forward until you get sat down, okay? As you come back up, stand back up with 2 legs, okay? So it's down with 1 for about 6 seconds, up with 2. To progress, all you do is make this box lower and lower and lower until you can get to a point where you've got that full kind of knee stability all the way down, all the way up. This second one is all about that kind of single leg control throughout that whole chain. So the hips, the knees and the ankle. Like I've said, one of the key things that happens when we're doing skiing, for example, is if that knee starts to fold in, that's a huge risk factor for ACL injury. It's called knee valgus. There's a few reasons that that can happen. It can be that the ankle rolls in and that brings the knee in, or it could be that you've got weaker hips and you get internal rotation, and again that also brings the knee in. So what we want to do is basically build full control throughout that limb, and one of the ways of doing that is single leg balance, Romanian deadlifts. So from here, just from this angle, what we're looking to do, balance on one leg, opposite hand to the opposite foot. You're going to come down, try and stay nice and controlled, and then back up. We don't want to touch this foot on the floor. And again, what you're looking for with this knee, ankle and hip is that control. So all the way throughout the process, you're trying to keep stability and stop that knee kind of folding in and out, okay? This is going to help with core stability and then obviously stability throughout that whole chain from the hip, knee and the ankle. So once again, we're looking at this deceleration phase. So again, with skiing, kind of that jumping and landing side to side, there's a lot of pressure going through the knees, and we need to control that descending period here. So we need to control that eccentric. So when we did the single leg squat, we're kind of coming backwards. We're sitting back into it. With this one, it's a little bit different. The knee is going to come over the toes. And again, this is a position that you're going to be in while you're in skiing. So we need to have complete control and not let the knee kind of pop inwards. So what you're going to do, one leg at a time, standing on the stairs, make sure it's the bottom step, And then what we're going to do from here is come down for 6 seconds. Again, try and keep that knee aligned forward, not like it's popping in. A few things you're going to notice with this one. You might find you drop straight away. That's just because we don't have that control or that ability yet with the quadriceps. Or you might find that your knee starts to wobble quite a lot. Again, it's just building that control. Or that knee will start to come in. Okay, so make sure the knee is straight over the toes. 6 seconds down. Good, and then you're going to come back up. Okay, you can do this on both legs. So it's 6 seconds down. Then use the handles to come back up if you want. So these 3 exercises are going to help you with that control, that stability, so that when you go skiing, you're way less likely to get an injury from that kind of knee valgus that tends to happen.